Well, you know what? We live longer. That's the good news in this lifetime, right? If we take good care of ourselves. And, you know, you want to look as good as you feel. And with us is a dermatologist, Dr. Elizabeth Arthur, with a really interesting new treatment for double chins.
Yes.
It happens to the best of us.
You notice all those selfies? When you take that and you're like, ooh, no.
Angles matter, people.
No,
Never take it from down here.
Or just
Alexis
get rid of the
is
double
trying
chin
it right now.
altogether.
Absolutely.
Yeah. But this is a common problem. As we age, our skin tends to sag a little bit, and, you know.
We know that it affects actually probably about 70% of patients, okay, or the population out there. And there's generally three sort of, you know, factors that create this double chin, all right? I have one. I haven't injected myself yet. But it's like, one, it's hereditary, okay? So somebody can be thin and they get it from their parents. Two, it can be sort of excessive weight, okay? Or three, it is the aging that, you know, as we age, our bottom of our face becomes much heavier. And this really sort of a lot of times defines our jaw, okay? And really, you know, when we first sort of talked about it, we talked about this burden of submental fullness, but selfies, you know, every selfie that I take, it like has to be at this kind of angle because otherwise you look like Jabba the Hutt. You know? So it's like, you know, so
Hashtag so true.
Yes, yes.
Hashtag Jabba.
Yes. So, you know, Kybella has been in the making for years, okay? It was actually sort of invented down at UPenn. And, you know, big clinical trials, 2,600 patients. It was approved over the summer, early, maybe in April. We got our hands on it, you know, very early in the summer. And it's been nice. And what Kybella is it's something called deoxycholic acid.
Okay.
And deoxycholic acid is actually a naturally occurring substance in our body that dissolves fat. It dissolves the fat in our GI tract. And so what we do is we actually inject it into this area of this submental fat or double chin.
Okay.
And it dissolves the fat. Most patients need about 2 treatments, okay? Some people are going to need more. I've injected my own husband, my mother-in-law, my sister-in-law, my friends. So, you know, most people are going to need 2 treatments. Some people are going to need more than 2 treatments. You know, but it's pretty easy. I mean, it takes me probably about 10 minutes to inject it.
Okay.
You know, we do some numbing medication, you know, because it stings a little bit.
It's a pinprick too, right?
It's little pinpricks.
And how long does it take to recover from?
You know, usually about 10 to 14 days because it does swell up those first couple days pretty good because you've created an inflammatory reaction, okay? And what's nice about that inflammatory reaction is that we do know that it will help contract the skin, okay? So somebody like me that I have fat and skin, I'm sort of the perfect candidate, okay? If someone just has skin, well, then they need a neck lift, okay?
Oh, that's different. Okay, so you're saying there's a difference here.
There's a difference.
We're looking at a before picture right now. So after that point, the skin sort of kind of tightens up, right?
It tightens up because of that big inflammatory response afterwards.
Wow.
Yeah.
That's pretty dramatic.
Yeah. And, you know, we don't use it in what we call the jowls. But we do know that if we can tighten up this area, that will actually make this area look more defined.
Okay, people watching this might say, okay, come on, really? Like, you know, but if you live with it,
it's huge.
It's be a huge self-esteem booster.
It is, because you look at that every day, you know, and over the years, you know, different treatments that we do and stuff like that, you can hide things. You can, you know, sort of maximize or minimize things with makeup. You can hide cellulite. You put clothes on. You know, it's like you can put Spanx on things, but you can't hide your double chin.
My neck Spanx.
I know, right?
You can't do that. You know what I mean?
Patent that. Okay, real quick, we got to go, but not covered. Is it covered by insurance?
Nope, it's not covered by insurance.
All right, so
you know,
save your pennies for it.
Yep, absolutely.
What's
it's
the
actually
ballpark cost?
Usually most people about $2,500 to $3,000. So.
And how long does it last?
And it's permanent. It's absolutely permanent.
Okay. Boom. Well, there you go.
There you go. Thank you so much.
Thanks for coming in.
Thank you.
We appreciate it.
Yep.
Next
Thank you.
Heard it here first.
Next Spanx.
Coming up next.
That and Jabba.
We're going to check in with Anna. She's been at the new, she's listening to music at the Record Archive. We'll check back with her in just a moment.